Could I get a motion to approve the minutes of August 9th? Heidi? Okay. Okay, thank you, Trish. Tonight we have 12 resolutions, no appointments. There's a resolution for Office for the Aging, 6 for the Health Department, 2 for Department of Social Services, 2 mental health, and 1 is the ledge resolution that we'll go over tonight.
I just get all in favor on the minutes, Elaine.
Sorry, all in favor on the minutes? Any opposed?
Aye.
Okay, okay, great, thank you. Is Brenda on the line? Yep, she is there.
Yeah, I'm here.
Okay, if you want to go over HH1, which is the authorization to accept funding from New York State Office for the Aging for expanding access to COVID-19 vaccinations via the Aging Network.
Sure.
Okay.
So this is an additional amount of funding that we have received to carry out any kind of education and outreach that the county might need, that seniors might need, that we can do to join in the health department's efforts. So we have had a brief discussion with Kathleen, and we continue to look for opportunities to collaborate, and also with the Cayuga Health Network. So there aren't any specific plans for this money yet, but there's ideas in discussion.
Okay, and this money is good for a period of time, Brenda?
This one is good through next September. Mm-hmm.
Okay, all right, could I get a motion to accept? I'll move it. Second?
Second it, Mark.
Any questions? Okay, all in favor?
Aye. Aye.
Thank you. Have anything else you want to talk about from the report that you submitted? Or do we go ahead.
Since I submitted the report, I wanted to just update the committee. In addition to what's listed there, I have not heard, gotten a quote from the Boyle Center renovations yet. I'm hoping to get that before too long. I did, as you see there, noted that we're continuing to really struggle, and I looked at our statistics for the past year to look at how bad has it gotten for our seniors to be able to get aid service in the community. And you can see there the number is 3 people total for the whole county for the whole year got hands-on personal care aid service through our services and our funding. And that's not for a lack of funding, that's because of the severe aid shortage. And 2 of those people were served in Auburn, and that is pretty much the only place we can get aids at all to do hands-on care is in Auburn. So I am going through a lot of steps to try to find other ways to access the hands-on care aids that so many seniors need to remain in their own homes. I'm looking at some options. I'm not really finding a lot of possibilities, but I keep looking. I'm in discussion with some folks. But in the meantime, I also have come across a wonderful opportunity to increase individuals' ability to remain in their own homes through a really dynamic and strong RAMP program that there is a model program in Oswego County right now that Arise does there. And it's sort of like the RAMP program that our local Arise does, but on steroids. Has a lot more capability, a lot more ramps are built each year. There's more funding, there's volunteers involved, and it's really kind of an amazing program. And the individual responsible for that program, Jim Krazak, is very eager to share information about that program, and he's looking to expand it into Madison and Cayuga counties. I did a quick check to see with my staff and with the Arise staff and with our nurses how many people request ramps from us every year. and it's at least 78 people every year that we hear from that are looking for ramps. And my understanding is with the CBGG funding that Arise gets from the city, I believe they're able to put in 4 to 6 ramps a year. And in the rural areas with the county funds that Cayuga County provides, they're able to put in 1 to 2 ramps a year. So we get 78 requests a year, and then we're able to install about 6 ramps. And so I wanted to bring this opportunity to the Ledge, to the Human Services Committee, with the idea that this is a program that with some funding that we have in our unmet need, we've just recently been awarded some unmet need money. I talked with Arise locally. They're very interested in partnering with us. And I talked with Gary Duckett because one of the pieces that would be needed to do this enhanced ramp program would be some kind of storage space for the components of aluminum ramps so that we could use them over and over again. And Gary's thinking that there would be some potential there. So there's some possibilities that I'm interested in perhaps having Mr. Krasik come and talk to the Ledge about what the possibilities are in Cayuga County. So I'm kind of excited about that. We've never really had this kind of opportunity. We know that Medicaid almost never pays for ramps. We know only some veterans are able to get ramps, and there really just aren't any other programs to pay for ramps in the community.
You know, I think you refreshed my memory. There is a $6,000 commitment that the county makes for ramp support. But if we were to this program, the way you're talking, actually OFA money under unmet need that could be used to do, not even require an additional allocation from the county. Is that what you're saying?
I am almost positive that the unmet need does not require a county match, but I would be looking for the county to consider an increased ongoing commitment. I would like to have our unmet need funds help establish a large inventory of ramp pieces, but there is always going to be the need for ongoing ramp building and purchasing of lumber. Some can be done with the aluminum ramps, but some will always need to be done with lumber. And that's the kind of thing that Mr. Krasik could talk about. So it would not be instead of what the county's doing. And actually, I would look for the county to take this opportunity to expand this area of huge unmet need to look at ways to piggyback on what the Office for the Aging can offer and what's being done in other counties to really provide a service that's desperately needed.
Increase the county's amount that they're giving in addition to some OFA funding and see where we could leverage those funds. Is that what you're saying?
Exactly. Correct, Elaine. Thank you.
I'm hoping that there will be an opportunity for him to come prior to this passage of our budget and address and you're working with Aileen about that possibility.
That's correct. Yep, I have asked Aileen, sent her the PowerPoint that he has already prepared to share. Arise has noted that they believe that the amount that has been allotted from the county for the ramps has been the same for about 2 decades. So it really is something that's time to look at that with our aging population. And it's also one of the ways that we're, again, trying to help keep people in their homes, being able to be served in the community, keep people out of the nursing homes, out of institutions, saving the Medicaid dollars. So it's a really worthwhile investment.
Okay, thanks. Any questions for Brenda? Trish?
Hi, Brenda. This is Trish.
Hey, Trish.
Just a quick comment. I'm really excited to hear about the RAMP program that you're looking into. I think that's great. Homesite / home headquarters does an access to home program that this could potentially, extra funding could potentially leverage what they are bringing in as well through the state. Right. So just to make sure you're aware of that.
Absolutely. Yeah, we all those people that call us for ramps, Homesite is definitely one of the places that we send them to, but they can't begin to meet the need, as you said. So yes, this would be building upon and adding to what they do as well. Mm-hmm. Thanks.
And then my one question I had was with, you mentioned there's an annual public hearing coming up for seniors or for, what is that?
So our Office for the Aging, as part of our organizational structure, we are required to have a public hearing every year. And during the public hearing, we talk about our funding, our services, and our plans for the coming year. So this is the first year we've had it via Zoom. And so it will be this coming Friday.
And can anybody can listen in or comment?
Yep, it's available by Zoom link, and that's a good reminder. We sent that information out in our newsletter, and it's in the newspaper for people to register, and then we will just send them the link for the Zoom meeting. So if you'd like the link, I'd be happy to send it to you.
I would love it. Thanks.
Okay, sure.
Anything else for Brenda? All right, thank you, Brenda.
Thank you.
If we want to go on to the health department resolutions, I was wondering if there would be interest from the committee to actually group together HH2, HH4, HH5, and HH7. And then we could get a motion for all of them in discussion if need be, but HH2, 4, and 5, unless Kathleen will correct me, are vacancies within the department. Correct. Okay, lactation. Public health sanitarian, HH5 is the nutritionist, 100% funded from WIC. And 7 really amounts to a budget transfer within the WIC budget. That is correct. Okay, can someone give me a motion for HH2, 4, 5, and 7, and then we can ask questions if we need to?
I move to bundle 2, 4, 5, and 7.
Second?
Second,
Okay.
Mark.
Right, are there any questions about HH2, 4, 5, or 7 that the committee has? Okay, hearing none. All in favor of filling those budgeted vacancies and allowing for the WIC budget transfer?
Aye.
Aye.
Okay,
Aye. Aye.
no one opposed. All right, great. Now you can go on to HH3 and then 6.
Sure. So HH3, we have some additional funding that New York State is giving us to try and help boost vaccination in our county, particularly amongst more marginalized communities and people with disabilities. And not exclusively so, there's a dedicated amount of money that needs to go toward that purpose. So we're requesting to accept some of that funding.
In a motion,
Nightingale move.
second? All right,
Per second.
all right. Any questions? Go ahead.
I was just wondering if you have a plan or strategy for use of funds.
I think that's a fantastic question to ask. And I will say, no, we don't. Although, and I think that's one of the things, we have some additional funding in different ways that wants to do outreach. And we would really like to be able to work to try and get some professional assistance in doing that. That's outside of our realm of expertise within the health department. That's our goal. So that's the plan, is we get some outside extra help to help us.
Need
with
a
it.
consultant or
A consultant
contract to help with
Yes,
communications
and get that stuff out there for us.
Great, great. Okay. But you have to accept the money first to be able to spend it, correct? Okay. All in favor for accepting the money, HH3?
Aye.
Aye.
Any opposed?
Aye.
Okay, great, carried. Now, HH6, Kathleen?
So HH6 is a request to purchase and enter into a service agreement with Meta to provide electronic medical record software and related services such as billing. Because we are in Article 28 and in Article 36, there are requirements by state health regulation as far as generating doctor's orders and billing for services rendered, as well as there's a lot more that Meta can do. However, the system we've been using for years is no longer supported. It was called Progressa. It was used during when we had a CHA service, a certified home health agency. And we retained use of that because we would generate the doctor's orders for home visitation and do some of our billing through there. Progressa let us know a year and a half ago it is no longer supported, and therefore we had to start looking for something else. COVID comes around, and we have a mandate to provide some billing for vaccination administration. So we had a great cooperative, which our staff can't say enough great things, and that's saying something for them to really, volunteer that information. The great cooperative between Meta and Auburn Community Hospital to let us utilize the hospitals and Meta services in order to be providing, to start billing for our COVID vaccination, because we didn't have the means to do that with the variety of insurance programs that were out there. It has brought in over $130,000, more than that, since we started last spring. So fast forward, we would like to formally a connection with Meta and ourselves to replace our outdated, no longer supported Progressa. The American Recovery funding that has been allocated to the health department to be used for COVID-related services can provide this cost. We will also be able to utilize a few services that we had not done before, like scheduling through Meta, which we hadn't done. And we do that primarily for our vaccination services, utilize scheduling. So this is my request to make use of funds in order to enter into an agreement with Meta for that service.
HH 6,
I'll move it, Kurt.
second.
Yeah.
Does anyone have any additional questions about this? I think, you had said to me, Kathleen, that when you realized you had to bill for the administration, really you were using the hospital license to try to accomplish all of this, which was the partnership that you were very complimentary about.
Yes, yeah.
And so now this will allow you to have your own license and assume those services.
Ongoing. And it will also allow us to generate some of the reports that are required for the Article 28 and Article 36 annual reports, statistical reports that we will not be able to do when Progressa no longer operates, which
Right.
it is not.
And you had said this is much cheaper now than it had been in the past.
It is. We're really fortunate the way costs are structured right now. It's based on your provider, and we have one provider, the medical director, Dr. Joya. So we're paying for one license,
Right.
And then, but as many people as need to utilize that can do so.
Any other questions about this?
And I will just add
Okay,
also that
sure.
I spoke with Kanban and IT to make sure that we have the ability to
Oh, that's great.
operate this on our own as opposed to just through the hospital licensure. And he did affirm that that should work out.
All right, that's great. Involving that. Yep, Trish.
Just another couple of quick questions. Is it cloud-based or is it?
It is cloud-based,
Okay,
yes.
all right,
So we do not need a server.
great. And then, is it comparable cost to the Progressive you said we're using?
Well, so we do have some annual costs that we had been paying. They stopped billing us this past year because they don't support it anymore.
Gotcha.
So we had some ongoing costs for Progressa. I do recall when we purchased Progressa about 15 years ago, that cost at least $50,000 when we made the purchase. That was a whopper. And I had this written down. Progressa, we had paid about $55,000 initially and $138 a month ongoing from that point. And then you're also paying currently an annual fee to another service that we had paid through our preparedness funding in order to get some scheduling system. So that cost of about $2,700 will no longer be incurred once we are able to utilize Meta.
All right. I had a second. Yeah, I did. We had a motion and a second. All in favor?
Aye.
Any opposed? Okay, great.
Thank you. Update now.
Sure thing.
Okay. So I guess I'll do a little shout out right now. I think April Miles may be listening, and she and I were speaking the other day. She's the interim executive director for East Hill Family Medical. And she's just wanting to stay apprised with what's happening in the county and expand her connections that way. And I will say that she's been an excellent partner, not only with, and the organization, with our ongoing services that we have done, such as our STD services that are mandated, but certainly a COVID response partner as well in the community. So did I give her a second? Hey, April, shout out to April. WIC is moving to their new location. It's beautiful. We don't have, it's so much more efficient. As you can see, we're quite down-staffed, so we're not quite ready to do, cut the ribbon, welcome everybody, but we have a few job vacancies and we have a medical leave, so we're really struggling to meet our minimum requirements at the moment with this very small staffing. So we will hopefully be able to fill these positions if for some reason, and we know the nutritionist in particular seems to be a very difficult role to fill, we may come back to the committee to talk about some alternatives if we don't have success in filling it.
Like a change in title or something.
Early interventions, to touch on that, just a lot of referrals, and Lori tries to speak to the Board of Health, and she wasn't able to be at the last one, but she gave me some information to share. A lot of referrals because there's a lot of need. There's a lot of families, especially now that kids are heading preschool. So it's the preschool referrals, there's the early intervention referrals. The pediatricians are doing all the right things by referring daycares, parents, families. We don't have enough providers, and that's a real hardship. And we're still trying to backfill a vacancy in early intervention, and we've got some interviews set up for the service coordinator. So with the need and with redirecting staff at times to help with our COVID response, we definitely are missing some deadlines, some regulatory deadlines. We know we're not the only ones. We know that the service provider need is throughout the county, or excuse me, throughout the state. But it's frustrating, right? It's frustrating for us because we want to be able to say to families, we'll be there. We want to meet that deadline. We are trying to provide more verbal education and instruction. And we would love to see the state kind of move in that direction to allow for unlicensed people to be able to go in if they have early childhood knowledge and experience and teach, work on skills with families and their children, and that maybe are under the guidance of a therapist or are in addition and supplement that. And that, so who knows, kind of the thinking down the line, but
Something the state will have to address it.
something the state will have to address it, and hopefully we don't get any overt things, but if we do, we'll tell you when it happens. Environmental health, we saw that we are down-staffed there. We're working on our critical programs, our water, our food safety, rabies, septic. It's, as with everybody, there's more work than people right now. We did get word that there's a push to adopt a polystyrene foam regulation, so it'll be interesting to hear what comes of that. The DEC is pushing that one forward. I mentioned that with our accounting staff, what's going on. Not only, again, are they helping with our COVID response and all the money that's coming in, which is wonderful, but money is not people, right? But they're tracking all of that and still continuing to be able to get money in. So I think that kind of leads us to our community health services. We're looking to identify to bring on another nurse. We're hoping to bring on a public health nurse, which would be a bachelor's prepared nurse. We'll see. We should know in another week or so.
We have an offer out.
Yeah, we were in conversation, and the person is going to be out for a few days, and then we'll come back and give us an answer. So we'll know more.
Then you'll be nursing full?
No.
No, you still have enough
Yeah,
vacancy?
still another vacancy, yeah. And so, I know you and I had some conversation earlier. I was speaking with Trish and Heidi as we were coming in here. It is just outrageously high numbers of COVID, again, in our community, as high now as it's ever been. And it back to the same number of positives that we were having in December, January, February. And we don't have the same number of staff members And it's a double-edged sword, right? First, nobody expected numbers to be this high, but they are. When there was a lull, some contact tracers, case investigators went on to other things. They said, great, I'll take the summer off. And so we're trying to bring people back in, and we are, but you can't respond as fast as the need is sometimes. I'm really conscientious that we need to really stick to hours to preserve our own staff. Now, we are working 7 days a week, and I've had to have some very frank conversations with a few people who say, you cannot work 7 days a week, because you can see people start to frazzle again. So just today, before I came to the meeting, I asked the charge person, who's our charge case investigator today, approximately how many positive cases were pending still to be contacted. And there were 115, at least. That was just this afternoon. That's not counting the ones that we did all day today. It's as soon as you do some, more come on. We are prioritizing our school-age children, because we're really working hard and working very closely with our schools, which it's very challenging for them as well, to try and identify our positive students and quarantine school-age children, so as to try and preserve the school space to be COVID-free. They're doing a great job screening people when they come in. But I think people have short memories, and they're very back to typical behaviors, which is okay until they're surprised that they're positive and can't understand why, or are worried about their child. Well, the more interactions we have with others, the more we expose ourselves to the potential of getting COVID. And then we have to identify, how to address that and curtail the spread. That's really what we're trying to do, is just slow it down, because it is everywhere. Hospitalizations are definitely up. We've been making a concerted effort to reach out to our regional hospitals to get the Cayuga County numbers, because Auburn Community Hospital has been great sharing the information with us right away, but it doesn't really reflect some of the more complicated cases that need to go to larger hospitals. So most of our Syracuse hospitals, now we're getting that daily report, and then we'll slowly try to expand that too. We know sometimes people go to Strong or to Cortland or Cayuga Medical or to Guthrie. We've certainly had some cases where people are in Guthrie. So I guess, yeah, and the other part of that is it's hard to redirect our own staff, because we have the everyday work that needs to be done. That we cannot relinquish that, right? Other communicable diseases we cannot relinquish. Early intervention needs we cannot relinquish. Clean water we cannot relinquish. But we're really, having a lot of conversations, and our directors are being so good about really prioritizing what has to be accomplished. But it's very discouraging, certainly for our staff who are working just so hard. And we were able to add on another health educator when you allowed me to create a new job. That health educator, theoretically, we would be using to connect more with the schools and do a little bit more outreach and some more social media presence. But we so need her help right now with case investigation, that's where the bulk of her time is being spent. And she'll come in and participate in other meetings, but it's a huge challenge right now. So that's on that side of it. And then we've got our clinic side. We definitely are seeing people, because of mandates, primarily, although not exclusively, come to the vaccination clinics. We're trying to have at least a couple every week in various areas of the county. So Tuesday and Wednesday this week will be in the southern area of the county, Moravia and Scipio. And their firehouses are acting as our saying that the volunteer firehouses are great. They're really great resources for us. And they really help us out when we go there.
Seeing more people attend.
We are seeing what we have been the last month and a half, maybe 25 people for an hour-long clinic. Last week we had 55 people at an hour-long clinic. But they're grouchy. People are, they're not all there because they want to be there, and that's the reaction we get on the telephone. So that if you have any suggestions or tricks of the trade to kind of keep our staff morale boosted, I am open to it because it is just, and I know it's everywhere, right? Social services has been helping us, other county people have been helping us, but we don't have our roles filled to work at our clinics yet tomorrow. Now, hopefully we will by 2:00, but we need people. So we are trying to recruit more case investigators, and we're trying to recruit people to work at clinics, and we will pay them. We're in conversation with the Community Health Network to try and act as that employer, and then we can subcontract to the health network. So hopefully we can, I've had Jennifer Marshall's been a great help. We need to work some things out because the simplest way does not necessarily cover us the way we need to as holding for liability and things like that. So we may have to, we've had conversations today, we'll have some more conversations tomorrow. But
And in all roles you need, not just
All roles.
immunizers.
nurses, yeah, sure, we'll take all the nurses we can, but we need vaccine assistants, people to greet, people to help people fill out the paperwork, people to copy the insurance card. You don't have to be a highly skilled person. We are going to train you to become a more skilled person. We're not even doing right now, because they're all walk-in clinics, we're not doing everything on the computer. We're doing it paper and then going back to the office and data inputting afterwards so that people don't have to have a reservation or spend the time tapping on the computer. They can fill things out while they're waiting in line. So people interested,
Send it to the net.
well, actually send them to Jennifer Marshall.
Okay.
She's going to help us at jennifer.marshall@DFA. DFA.state.NY.us. Thank you. And I know that Jennifer works in DSS, and she's just been a tremendous help for talking things through and identifying effective ways to try and winnow down what our needs are.
So she got a shout out and April.
And April did, that's right. And we're now, it's tough out there. You'll see we're sending out some more press. Stay home if you don't feel good. Stop. Limit the exposures you have to others.
Go ahead, Trish.
Boosters, what?
Good question. Yeah. So right now, there certainly is discussion nationally about boosters, and the FDA hasn't fully approved that. My understanding is Pfizer is at the forefront for looking at that, and we think we're going to hear more on September 20th. But I guess it's not a done deal yet, as they're continuing to do more conversations. Moderna won't be approved right away if indeed Pfizer goes through, but probably will follow carefully. A few weeks ago, state health was saying to us there are certain ways they're going to want that third dose tracked in the computer system. So it may not be as simple as saying, come to the regular clinic. We'll see. We're going to learn more. We certainly will provide the boosters when they get authorized.
Is it still 8 months after? Is
8
that what you're
months
hearing?
after your second dose is the talk. We'll see if they're like studying with Moderna, whether it's the full dose or whether it's a partial dose. Janssen isn't even, to my knowledge, part of that discussion yet. So more to come. Now, if you are immune compromised, your third dose can be garnered. It tends to be healthcare providers and pharmacies that are doing that right now. We're going to wait to do that third dose, whether you're immune compromised or getting a booster at the same time. So as to keep things a little more focused at the clinics we're offering.
Are you hoping the pharmacies will play a bigger role now that there's enough potential vaccine out there? I mean, before people were dying to get access, but the health department will play a role.
Yeah, we hope to see greater
Pharmacies.
expansion amongst healthcare providers, to be honest. And part of that has to do with the packaging of the vials of the vaccine, because they come, most of them, in vials of 10. So if you're in the doctor's office, maybe you're only going to feed 3 people all day. So that want that vaccine that particular day. And it's you don't want to waste, right? You don't want to waste. It's that fine line between get them the shot when they're ready for it right then and there, or saying, come on back so that we can get 6 of you on Friday morning and we'll open a vial then. But they're doing a good job, and we absolutely hope, we know that pharmacies will continue to provide great service that way. And depending what the regulations are, open discussion again with our towns and villages. They were fantastic when it came time, early last year when we were trying to get particular older population vaccinated.
What is our current percentage of full vaccination?
I don't know exactly, it's slightly over 50%, might be as high as 54% right now, but I have to check that. I'm not sure.
Higher for the over 65, but overall, you mean?
Overall, that's for overall for all the eligibles within the community. I believe that's it, but I'll find that out and I'll let you know.
Okay, thank you.
Mark, Mike, any questions from you? Thank you. You have two resolutions from DSS. And if you want to go through HH8, which is the new qualified individual that you and Ray have been talking about. And then after we do that, you can go over 9.
Okay,
Okay.
so HH8 is, we are seeking to enter into a contract with Cayuga County Mental Health to have individuals at mental health complete reports and assessments on children that are placed in foster care that have been placed or are going to be placed in a qualified residential treatment program, QRTP. So starting September 29th, there's going to be a change in our practice. It used to, well, it is still now, but starting on September 29th, the department will no longer be able to make a decision to place a child in a residential program and have that be the decision that the child can stay there for the determined time that we make. We're going to have a qualified individual, QI, who is a clinical trained person who has child welfare experience for a certain number of years, who's been designated as QI, who will be conducting assessments on a child that is placed in a residential treatment program. So residential treatment programs, these QRTPs, are residential programs that we work with right now that have gone through a credentialing program to establish that they're trauma informed, that they have nursing staff and clinical staff on call 24/7. They have an aftercare program built in for the child. And they have a holistic approach of not just working with the child, but working with the family as a whole. So these QRTPs are where we will be placing our most needy children that are in foster care, that have significant mental health issues, significant behavioral concerns. And the purpose of the assessment that the QI would perform is to look at the child as a whole, look at their history, look at their behaviors and the problems that they're having, and conduct some assessments of their own that they are able to do as clinicians, and summarize all that information and give it to the court. And then the court will look at this information that comes from the QI and determine whether or not the child is able to stay in that residential program or not. So we are required to have these QIs conduct these assessments on these children. So right now we're looking to start with a contract with mental health. Part of the resolution is also that we have the ability to contract with other providers as well. So we will be looking in the future to have people through the other residentials, like William George, Ellen Crest, to contract with them to also do these QI, have a QI that does this assessment. Because we have to have, it has to be a neutral party. So it can't be a child's placed at William George and they can do their own assessment. It has to be somebody that's separated from that agency so that it's an objective opinion on this child. So I was telling you a little bit earlier that we're getting information kind of fast and furious on this. There's a webinar that's coming up on Monday that will talk about potential reimbursement opportunities through Medicaid for a portion of the QI's assessment. Some of that clinical work that they do, the work with the child and the family, will be able to be billed through Medicaid. Some of it will not. So whatever is able to be billed through Medicaid, we will seek that reimbursement. The portion of the assessments that's not covered under Medicaid, or if the child is not a Medicaid qualifying individual, then we will have to, we'll have to cover that. So that is.
I get a motion for HHA? Okay, and second? Okay, now is there any questions, further questions about, all brand new, right? Totally all brand new,
Brand new,
all part of Family First.
part of family first,
Yeah.
yeah.
And
And it's a good thing. This is a good thing. I mean, it's the whole aim of this is to have children that, only children that need to be placed at this level, be placed at this level.
Right.
And for the time period they need to be.
For the time being, this would great, with the revenue come in and offset the cost for the Cayuga County mental health. Essentially, could it be revenue generator for mental health, or?
Revenue generator.
I think so.
They said they'll lose money.
We'll lose money.
You'll totally lose money.
Yeah, the assessments themselves, according to what I've read so far, depending on the child, the history that we have and how much time they need to spend on the assessment, it can take anywhere between 12 and 15 hours to complete. So it's a pretty substantial, lengthy summary, and
Like in the old days, the parental assessment was a pretty comprehensive assessment. I just didn't know if this would be eligible for 62%. But it's unknown. It's Medicaid eligible, and if they're
what I read today, it leads me to believe that if it's not Medicaid reimbursed for the clinical assessments, that the portion that's left would be an administrative cost.
Okay.
And that we can claim it under the administrative,
okay.
our administrative claim. But that, again, I don't want to say 100%.
Could be some state and federal to it. Right. The bigger risk is if the child's there and they don't qualify, and then you're either foregoing any reimbursement, or you're being forced with discharging the child and trying to find a place.
We would have to find a different level placement for the child.
How many children approximately in a given year?
Right now, we have 10 children in residential. The children that we currently have in residential are grandfathered in, so we do not have to conduct the assessments on the 10 children that we have in residential today. But I'm hoping that it's not very many at all. I think between now and the end of the year, I guess I would hope that we would only have a couple, maybe one or two. It's just, it's hard to know. But I don't think this is going to be like massive quantities of children. I think it will be a pretty low number. But, I can't give you, under 20.
Okay.
And you're trying to discharge the ones that are there as quickly
Always.
as possible too.
Always, yes.
Okay, get a motion and a second, all in favor?
Aye.
Okay. And-
Aye. Aye.
Okay, then HH9, amending the heat contract and changing the money. The action agency?
Yes, so I had brought a resolution in, I think it was last month or the month before, asking to enter into an annual contract with, for the heat program. What happened since that was approved, and I think it was like last month, the date of regular heat season was moved from November 1st to October 1st. The folks at CAP that we bring on to help with the heat work always start a little bit before the beginning of the month that heat opens. So I need them to be at CAP running, ready to run for October 1st, which means they have to start this Friday if we're able to. So because they need to get training, that, they'll be online, getting some online training. They'll be getting updates on anything changing with the application and the process. They get some, some practice with the applications that we have here with our early outreach for folks that are eligible for that we already are processing paperwork for. So that's really the reason that I asked them to send me an amended budget to get them started in September instead of starting in October.
Yep, you'll amend the budget and we'll amend the date of the start.
Correct.
Yep. Get a motion for that? Second? Okay, thank you. Any questions about HH9? All right, not all in favor? Okay. Anyone opposed? All right, great, thanks, Kristen. Do we have other things you want to talk about? I ignored you last month.
So I wrote a few bullet points on our, on our summary that talked about ERAF. I did want to talk to you a little bit about the most current information I have on the ERAF, which is, I think is very exciting.
Yes, yes, that's really,
So we're doing even better than I told in the summary. As of the end of August, we have 104 payments for rent arrears that went out to landlords, totaling $446,000.
so it took forever to start moving, but now it
Now
is,
it's
right?
And we had 71 payments that went out for prospective rent to tune of $150,000. So in total, we've had almost $600,000 being paid out to landlords for Cayuga County residents that had rental arrears. And some of them are getting help for some prospective rent as well. So I looked at our, I don't want to say performance, but how we're doing kind of compared to other counties, and I was very pleased to see our numbers. I think that, it shows that we've done a really good job at the outreach, getting information out, helping people with processing applications. Very, very pleased to see that.
I didn't think they paid prospectively. They to help people get a rental
For a
property.
few months. So if somebody qualifies
Okay.
for ERAP funds and also, apply for rent going forward, they are able to get a few months of rent going forward in addition to.
To get them to move in and whatever you have to pay up front. Is that what you?
Well, they're still in their apartments, so they're living there,
Okay.
but they were behind on their rent and they're asking for the back rent to be paid.
Yeah.
A portion of their ERAP application asks for some rent going forward, so from here, the application
Okay,
is forward.
so backwards and.
And a little bit forward.
Okay.
Yeah. And the other exciting news about ERAP that I wanted to share is we were on a call the other day and found out that they are going to be allowing landlords who have had tenants that have moved out of their apartments also be able to apply for ERAP funding for that back rent. It's not as much money in a pot that they are going to be able to apply for, but it is some. So that's very exciting. We've had landlords call here and get very frustrated because they have had tenants leave, wish that they were able to apply for this funding, and now they'll be able to.
So they weren't able to evict them, never got paid for them,
Yep.
and now they're gone.
Yep.
Oh,
But they have, they can show up with by their lease, who live there, they can attest to that. So that's a really good thing.
Yep.
And the other thing is there's a little pot of money also that they're setting aside. I think it was, I don't remember how much it is, I don't want to say, but there's a small amount of money that they're going to put aside for income threshold to go up to 125% of the area of the income. Right now it's 80% cap. So there's going to be some money for folks that make more than the 80, less than the 125 to also apply for ERAP funding. So that's going to open up to some folks that haven't been able to apply right now. So that's going to be happening very soon. We're going to try to push out some information on the website. I was going to get in touch with Monica and ask her to do a little blast out to the folks that we have on our email list about this to kind of get the word out, because it is going to be a first come, first serve. And we want to get people knowing about it and getting the information as quickly as possible.
Christine, did you say there were 2 landlords who received?
2,
Yeah, did you say?
there were 70, there were 104 payments of rent arrears that went out, 104. And there were 71 prospective rent payments that were made.
We don't know how many individual landlords though. I mean, not that 104 doesn't necessarily mean 104 different landlords.
That's correct. That's correct.
That's
We're
what
starting
I was
to,
curious about.
yeah, I can try to see if I can get that. We're starting to get more detailed breakdown. This was like the first time I've seen like really specific information about the money that went out. They had an average of what the check was. It was like $4,000, I think, for the rent arrears was the average check to a landlord. So I don't know that I have the number of landlords, but I think that we probably will see that coming. They're really getting much better. It's taking a long time, but they're drilling down to that data for us that we want to see.
Great, thank you.
Is CAP managing that program still? They're doing the application?
The ERAP,
Okay. And I was wondering, with the, they'll continue that with the changes that are coming forward with the landlords or the tenants as well.
Yeah, they will be, yes, they'll be able to still help out with that. And the other thing that they're hopefully, I think this is a big thing, is the applications that people had to fill out. They're pretty complicated as far as like the information that needed to be uploaded. They said that it wasn't gonna be that hard, but in the end, it did end up being kind of difficult to get all the information in and have a completed package to present that they would then approve. So I think the community partners have been instrumental in kind of walking people through that and helping people to upload documents. And so I think that that's where we've been successful at having people that have really, taken that on.
Just a comment too, when Ray sent out the statewide numbers, I noticed that our numbers were among the highest in the state for getting money into the county. And I just want to commend you guys for the work that you've done on that. It's really great.
Yeah.
It's really great.
That was all. Okay, all right.
Thank you.
Yeah, thank you. Right. Yes, okay. Just like your stand-up desk, right?
It is.
That's right. Okay, you have the two resolutions. HH 10 it's nothing new that we haven't seen before. It allows you to enter into agreements.
Right.
To take people in and,
We take a lot of interns in from a number of different schools.
right. Okay, can I get a motion for HH 10 to authorize the Director of Community Services to enter into a 5-year agreement with colleges or universities for social work interns or medical students? Second?
No.
All right. Any questions about that? All right, all in favor?
Aye. Aye.
Okay, now, if you want to talk about HH 11, you're looking to take advantage of one vacancy that's coming and to kind of abolish one position and create and fill a different title.
Right, yeah, supervising social worker is a title that's more appropriate to our operations right now. Making this change, eliminating the senior social worker on her retirement, which is the end of October, we saved $1,000 and, infringe. And we have the same staffing pattern that we have now in terms of the number of people that are working there. So it doesn't increase the actual staff, but it's a more effective way to sort of manage the operations. And we thought this would be a good time to bring it forward before her retirement. So the whole thing ends up timing up so that we can fill it when she retires. And then we'll abolish that position, the current senior social worker title that's filled.
Can I get a motion for that? In a second, we can have any discussion.
I'll move it. Sure.
Second? Like I go? Yep. And the initial savings comes from the grade 4 and the starting salary. This senior staff social worker is a lower title than the supervising, but
Right.
you're really looking at putting an infrastructure in your operation.
Yeah, she's making $72,000 now in that position, mainly because she's been there 20 years. Has been in that position for a while. So the supervising one starts out at 65. It's pretty good saving. Also, definitely a more effective staffing pattern for us in terms of providing oversight to the clinic.
Any questions? Any other questions about this? Okay, hearing none. All in favor?
Aye.
Okay.
Thank you.
Do you have any?
Yeah, a couple
you want
things.
to talk about? Okay.
Pretty excited about this. So I've sent some stuff out around, the overdoses and the overdose deaths and all the different work that's going on, because we're on that as well too. And sort of trying to sort of increase the availability of medication services for people, keep them alive and get them into different places for care. We had conversations with Farnham, which is a drug and alcohol outpatient agency up in Oswego, whose work that I'm pretty familiar with in the region. They were working with Chad around some sort of, collaboration that didn't sort of pan out, but they did agree to work together on a opioid treatment program, which is an outpatient treatment program that provides methadone, Vivitrol, and Suboxone, buprenorphine to people. They wrote a SAMHSA grant. Farnham wrote a SAMHSA grant to get the $1 million of startup money for this because they're very expensive programs to run, and they got the award. So this will be a program that's coming to Cayuga County. This will be great because we probably have around, I don't know, 65, 70 people who are on methadone that either take a bus or drive to Syracuse every day to get their dose and then come back and go to work or whatever else they got going in their life. So this will be it's just going to be a great opportunity for folks to get access. I think it'll help Chad too, because I think that relationship will provide some additional prescribing help and some different sort of expertise that's going to be really helpful. And I know that they, Christine's on the board over there and they're searching for new executive director and all that because Kevin's retiring at the end of the year. So I think this is perfect timing for all of that stuff to happen. So it was just really good news to have someone that's going to get in this fight and definitely, impact the work and, save some lives.
Okay.
So I just wanted to talk to you about one more thing. So I've been talking over the past, I don't know, while about the these things. See, when you don't shave, they stick and then they pull down and everything. No, that's all right. Our caseloads are pretty high. The prescribers have an awful lot of patients that they're seeing. The clinic is really getting slammed pretty good. That's been an ongoing issue. I wanted to use some of our reserve funds. We have about $1 million that we've been able to reserve over the years to sort of bring in some additional people and bring in some additional services to help with this work. And then, was really concerned about this school year in terms of there's still, like Kathleen's talking about this too. It's like this thing hasn't gone away. And I think that going back to school has caused an awful lot of anxiety among parents and kids and teachers. And so we expected there to be some spike in need, which we realized this in the first 4 days of school. There's all kinds of stuff happening with the typical kinds of things, suicidal ideation, homicidal ideation, kids really very anxious. So we get really busy. So I put in a proposal for some of the recovery funding to be able to have a couple of crisis teams, one to work with adults and one to work with kids that would help. And so those things are still floating out there. The biggest issue that's happening right now to us is Cayuga Counseling Services has lost all of its child psychiatry, which is going to push between 50 and 150 new kids into the clinic over the next couple of weeks. We don't really have any place to put them. So we're trying to figure out how that's going to work. So we need some help. So if I could get some answers.
Yeah, I was just going to text too, but it's my understanding that it will be this month that the American Rescue Plan proposals will be coming forward to the legislature. And if you have one in there for the addition of staff at mental health and some staff at DSS.
So we were talking about putting together a social worker with a child welfare worker to respond to kids' crises in the county, because that makes a lot of sense. And then an adult protective worker and a social worker to respond to.
So like a crisis team.
Crisis teams that could do a lot. A lot of this work can be done in the field, can head stuff up. But now I'm really jammed from a prescriber's perspective. I don't have room for all of those kids. So I'm going to need to hire somebody. So I have money for that. So we could talk about how we can make that happen sooner rather than later. If that's a possibility, that would be really helpful. I've got people I can bring in.
You mean your account where you have discretionary funds, or you mean within your current budget, or you mean all the above, or
It doesn't matter to me.
whether it's the ARP money or it's another means of funding this initiative? That's what you're hoping to
Well,
get.
just generally speaking, I think, yeah, like it doesn't really matter to me where the money comes from. I think that what's important is that the money is really, so when you bring someone on in the clinic, whether it's a prescriber or a clinician, there's this period of time that it takes them to get to full capacity. Once they get full, the positions, there's a time when the position pays for itself, and then it continues to generate additional revenue just because it does, because the person gets filled. So I don't really even need any money. I could use the money to seed it, but just permission to do something to sort of it's gonna be a really awful year on top of everything else. And then when these kids come to the clinic, they're not gonna go back. We have to be concerned about disrupting care on both ends. And I'm not really quite sure what this looks like.
And what's the adult protective role in this crisis team? Because it's adults and children? I mean,
So a lot of the stuff that the departments work together, right, is really important. And that's gonna continue in the future because it's been beneficial to the departments, both of them. So typically, when we get a mental health crisis in the community for an adult generates a call to the clinic and oftentimes to adult protective services. So we work together to go out and figure out what's going on in that case, because maybe, you know,
Bring
APS,
different
there's
perspectives.
different competencies in both
Yeah.
departments, plus different resources in both departments. So we just pull them all together into a case. And we've had some really great successes with really challenging, difficult cases. So, and a lot of those folks that experience those so a lot of the adults that have that experience crisis in the community, not all of them, but a number of them are sort of helped by that sort of arrangement. The other ones, maybe just a flat out, somebody struggling with severe mental health issues and all that. Team can do the assessments and all that and then figure out kind of what to do. The ACT team is getting much more involved in stuff, and we're starting to get more people attached to that, which has been really helpful. But it just seems like a nice way to do the work. It's work for both staffs. It's nice to have that sort of support. They're not on an island by themselves. They're doing it together. I think that's the work when we talk about what happens, you know, when I retire in January and the position split. It's really important that work continues. This is another way to sort of, you know, knit it together in a way that it doesn't come apart. So I'm open to other suggestions about how to do it. That just makes a lot of sense, given like most of the stuff that we've seen lately has been some really impaired adults that had multiple issues related to one, mental health, housing, guardianship. Those are kind of extreme cases. Then you got the other ones where people are just having a really hard time, won't come out of their house, that sort of stuff. So I'd like to be able to, you know, manage that before it becomes a problem that's unmanageable.
you would have to create or at least fund some additional positions that currently aren't in your budget or available now to make this team.
Yeah, I think that, like, I guess what I would say today would be, those teams would be really helpful.
Mhm, yeah.
And that can get done. Once you start billing. Because you can bill for those. Everybody okay? And then some additional prescribing, whether that's a you know, a staff or a contract.
Okay.
You know, that would be helpful. The case slows down. I got to figure out what to do with these kids. This is going to be a thing, a big thing. No, but I have no room. We can't get people in the frequency that we want right now for their med management. Just
Ray,
slammed.
the prescriber, the psychiatrist that's lost at CCS, so you're a loss of about 150 for about 150.
I'm trying to figure that out. So Pratt's, our child psychiatrist, was working a day there. He had a caseload of 150.
Okay.
So he's not going to be working. I think this is last week coming up. He's reduced his hours. He's just going to work for us. And then they had a 3-day a week. I think she worked 3 days a week. A nurse practitioner, psychiatric nurse practitioner, and her caseload a couple hundred people. So.
And that position's also,
That's vacant now too.
Okay.
So the psychiatrist tells me 200 people, you know, and I don't know if that's accurate, but if it's 50 high-risk kids, that's a lot, you know. And then what typically happens is everybody that he saw over there will probably want to follow him, because that's what happens. People do that. I mean, they get to pick where they go and try not to say no to that, you know what I mean? We're just still trying to figure it out, but I can just say that wherever it lands, we're not going to be able to do it with in a way that's really safe, manageable, and all that. I know that they're trying to find some prescribers and have their feelers out. I don't know. I know that the patients because they can walk in and get seen, they tend to do that. So they're starting to show up now. We've already had people migrating over to the clinic with medication issues that they need filled and all. I know Mike's he's writing bridge strips to try to keep people okay, but that's still not good practice for kids. You don't want to medicate kids for a couple of 3 months without them seeing a therapist, finding out about side effects and all of that sort of, or nursing either.
Just so I'm clear, you're talking about two different things. You might need another prescriber to fill the gap in the community that's been lost in terms of mental health. clinic.
Yep.
And you also have a potential proposal of putting a team together.
Yep.
And if you could give us kind of a, even from your point of view, that, you would like to add these particular resources to these two departments, what they look like, and put this team, at least
That's
we
the
could.
proposal.
You do, oh, you already, that is the
that
proposal
part
that's
is in-
already in there.
Right, so we talked about the
Okay.
two social workers, the APS worker
Okay,
and the child welfare worker. That would be a team, so they'd be located in their departments. And there's things that they can do in the department that doesn't tie them down, right? Like there's work to do.
so, no, it's written down and
It's
it's
written
got,
down in their proposal. The prescriber is an extra thing.
okay, the proposal's gone to.
But you can roll that in there too.
Okay. Okay,
But these things, they really don't cost money. They pay for themselves. It's just really permission to try to meet the need.
staff up to do it.
That's really what it is I'm looking for. If there's money, to seed it, to start it, that's fine too. It's not a deal breaker if there isn't, unless, the legislature feels it's a deal breaker, but it's not for us. And financially, I don't think it always ends up working out.
Okay. All right, so that proposal hopefully will be,
Yeah, no, I
It is
haven't
part
heard
of
anything about them.
okay, all right. I'll ask, I'll.
Other than that, things are good.
Yeah, okay,
Can I
But
ask?
it's a lot of stress over there, just so you know.
sure.
Yeah. Just a few follow-up questions, right?
What's that?
Just a few follow-up questions.
Sure.
First of all, that grant, was it Oswego Farm, you said?
Farnham, FARNHAM.
Farm.
Yep, they're a large outpatient provider.
Oh, okay. Will they have a physical presence?
They have to. They'll
Okay.
open up a satellite here. So
That's
they were looking at doing
fantastic.
it, they were looking at originally, they looked at, the space at Chad. So I don't know, that'd be kind of the board decision around, they have to rent more space. Have you ever seen one of these things? You have to have security. You've got the mixing machines. You've got the wall, you've got the nurses on one side, you've got patients coming in. It's all very calibrated. It's controlled substance, so it's got a lot of different regulations. They're also probably going to look at the place that Nick's Ride just redid down there across from the Holiday Inn there, because that space isn't really there's plenty of space there, there's room for it there. So it's going to probably be at one of those two places. I think Eric's going to come over and take a look at some spots. They definitely want to co-locate the services, because there's stuff that Chad can do related to their Article 32. These guys can handle the medication part of it.
Great.
Yeah, it's very exciting.
That's great. And then the physician CCS lost, it was a child psychiatrist.
Child psychiatrist and a nurse practitioner who also saw children.
Okay.
So I don't know like the mix of her case. So they're going to be talking to Heather some more to try to get some more specific information.
Okay. Okay. And then just a comment, I saw recently, I think it was Onondaga County that used some of their ARPA funding
Yep.
for this in schools
Mhm.
specifically, and I don't know the details of it, but,
I'm pretty familiar with what they're doing. I've talked to Anne Rooney about it a couple times.
okay, all right, so I just wanted to mention that.
Mhm. Yeah, I think a lot of the counties have used this money. I think that one of the things that people have learned, we've all learned, right? Like, so there's things that have happened during this pandemic that highlighted issues of homelessness, health parity and disparity, mental health issues, substance abuse issues. It's really, you get a look at this, and I think a lot of counties are seeing that now. Maybe they didn't quite see this that way before, and making those kind of investments. Cortland's building a new county clinic building because the one that they're in is a toilet. It's really bad. Other counties are doing different things as well too. They're just taking care of the people, what I mean?
Did you have other proposals in for the use of that, or this is the one?
I think DSS had a couple.
Oh, DSS there too?
I think that was the only one I can remember. but I can write up a couple more.
Well, I'm not saying, I'm just wondering.
No, I think that was the important one. That stuck out to me to be from a system of care perspective. You know what I mean? Like that response during the day, we get a lot of crisis calls, takes staff away from seeing patients. We get a lot of calls to go out in the community, accompany the police, accompany APS. Managing that a little bit and having them have a dual role in terms of carrying some cases and stuff like that fills that sort of gap, which is a gap. I think the outpatient part of it, you know, we're pretty good at, you know, with the open access and getting people assigned and seeing people and getting them treated and all of that.
They're not tied to a caseload. They're free to do this kind of.
So we'll have them like, so on our end in the clinic, so we have people walk in all the time, so they'll be able to do walk-ins and, you know, so if there's a call, it'll take them a half an hour to get to, that's not bad. They'll also do, you know, the crisis calls and stuff like that, and then they can be dispatched. Same over at DSS, there's work that the child welfare worker can do and the APS worker can do. It doesn't tie them down, that they can do around, you know, function around the work and be able to do both things. And I think that's very efficient. So you don't want people sitting around 5-6 hours and then getting a call. That's not useful. So we thought carefully about, you know, how can this work in a way that we maximize the benefit from the opportunity, which is really important. So yeah, we could talk some more about that. That would be really helpful.
Okay.
Staff would be grateful too. So other than that, I mean, those are the two big things that I wanted to sort of communicate to you guys. If there's any questions, I'm happy to answer them.
Okay, thank you.
No questions? Okay.
No? Is there any?
That noise, everybody's okay?
Okay. Yeah. Okay, the last, and I don't know if Rich is on, in case we have any questions, Rich is going to be dialing in. There is a legislative resolution on the agenda tonight, which is fixing the day and notice of the public hearing on the local law, repealing local law number 5 of 14, and establishing the positions of Commissioner of DSS and Director of Mental Health. So this obviously is what we have been talking about. There's an attached law around this. This will allow this to go to a public hearing. We have any discussion on, and then eventually to a vote by the legislature. And if this is passed and supported, then we would move with the plan to, you know, be looking at positions and, you know, recruiting and hiring a DSS commissioner and a director of community services. So, you know, talking about this forever, and if I could get a motion for this resolution, I'd entertain.
A little bit for
Dr. Hyde. Do you guys have any questions, Mike or Mark? Okay. On
So
favor?
Elaine,
Go ahead, Rich.
Elaine? Yep. I noticed the title on the resolution should be amended. Instead of saying the Director of Mental Health, it should say Director of Community Services.
And that's basically the title that's going to be, that's already been approved through the state, and that's what it will stay upon it when the title, is that what you're saying, Rich?
Yes, I mean, the local law is titled, you know, Director of Community Services, so the resolution should, you know, parallel that.
Amanda, would you make that amendment?
Yes, I can change that. And so for Ways and Means, it'll be corrected.
Thank
Right.
you.
Okay. Yep. That's all.
There's a little bit of a tear.
Any questions or any further business? We did vote on that, right, Amanda?
No, I need an all in favor.
All in favor of passing this resolution, page 12?
Aye.
Mark, Mike, yes?
Yes.
All right. And fast. Thanks. Okay, do we have any further business? Take a
Alrighty, thanks.
Bye.